Hello everyone, hope you all are fine. Today we will discuss about role model for healthcare providers are essentially required to set in Bangladesh. This topic was written by Professor Sheikh Feroz Uddin Ahmed. So let's start. Medical doctors and pharmacists are the main healthcare in a healthcare system. Government of the People's Republic of Bangladesh is the main planner and regulator of the healthcare practices in the country. Drug is one of the most important items used in the healthcare system. Government of Bangladesh needs to set the principles for the provisions of good medical and pharmacy services. Competent pharmacists provide and interject services to support the provisions of the medical care of the competent medical doctors. Doctors and pharmacists are to be sincere in their practices. The Pharmacy Ordinance of 1976 does not contain the necessary laws to regulate all of the acts of pharmacy practice. The ordinance also does not actually contain laws to control the real acts of pharmacy practices, and thus doesn't give power to PCB in Section 33 to create rules and regulations for the practices of pharmacy. For that, Govt of Bangladesh requires to enact and frame comprehensive pharmacy practice laws to control and standardize the pharmacy practices in the country. Role models indicate the specific functions within which a classified group of professionals, health, is allowed to offer and provide their services and practices to the healthcare consumers. Role models are fixed and set by the government upon discussion with the stakeholders and the health professionals. In Bangladesh, role models of the doctors and pharmacists are highly required to configure so that competent doctors provide the medical cares and competent pharmacists provide the pharmacy cares. Pharmacy Practice Act is required to enact to cover all matters related to pharmacy practices in the healthcare system. Bangladeshi doctors can practice in the health system and are good in the provisions of the medical cares. Due to the unavailability of the pharmacy practice laws, competent graduate pharmacists are not getting scopes to practice pharmacy in the healthcare system. Good practices of medicine and pharmacy will absolutely bring quality assured delivery of healthcare to public. It may be expected that enactment of a comprehensive Pharmacy Practice Act of Bangladesh will contain all laws necessary for good practices of pharmacy. And thereby, the Pharmacy Council of Bangladesh will be able to configure necessary rules and regulations for the correction of the prevailing situations of backwardness in the practices of pharmacy of the healthcare system of Bangladesh. Thereby, necessary model roles for the pharmacists and other health providers will easily be configured so that the doctors, pharmacists and nurses will understand their individual roles and responsibilities. Thus, patients will get real benefits from the health system.